How do doctors test for hepatic encephalopathy with cognitive tests? Imagine trying to catch a subtle change in mental clarity before it becomes a big problem. That's exactly what doctors aim to do when testing for hepatic encephalopathy. They use a series of cognitive tests to spot early signs of brain function changes caused by liver issues. These tests focus on key areas like attention, memory, processing speed, and problem-solving skills, which are often affected in hepatic encephalopathy. One of the main tools is the Psychometric Hepatic Encephalopathy Score, or FES. This is a set of 5 simple paper and pencil tests that check how well someone can pay attention, move quickly, and think clearly. It's a popular choice because it's affordable and effective at catching even mild or hidden forms of hepatic encephalopathy. However, the results can vary depending on a person's age and education, so doctors compare scores to local norms to get an accurate picture. Another common test is the mini mental state examination. This provides a quick overview of overall brain function, looking at memory, attention, language, and visual skills. While useful, it might not be as sensitive as FES for detecting early or subtle changes. Memory tests like the Ray Auditory Verbal Learning test help identify if a person has trouble encoding or recalling information, which can be a sign of cognitive impairment linked to liver problems. Computerized tests, such as the Stroop test or inhibitory control tests, evaluate attention and response inhibition, which are often impaired in hepatic encephalopathy. These tests requiring patients to respond quickly and accurately to various prompts, revealing issues with mental processing. Doctors might also use simple reaction time tests or the Wechsler memory scale to assess working memory and visual reproduction skills. These can pick up early cognitive shifts, especially in patients with liver conditions like hepatitis C. In addition to these cognitive assessments, neurophysiological tests like the critical flicker frequency, electroencephalography, or auditory evoked potentials can provide complementary information. These tests measure brain activity directly and can help detect abnormalities associated with hepatic encephalopathy. Choosing the right tests depends on the patient's condition, available resources, and clinical judgment. The goal is to identify cognitive changes early, even before symptoms become obvious, so that treatment can be started promptly. Early detection allows healthcare providers to manage symptoms better and prevent progression to more severe stages of hepatic encephalopathy. In summary, doctors use a combination of standardized cognitive tests like the Psychometric Hepatic Encephalopathy Score, along with neuropsychological and neurophysiological assessments, to evaluate brain function in people with liver disease. These tools are vital for diagnosing, monitoring, and managing hepatic encephalopathy, helping patients maintain their mental clarity and quality of life. Always remember to consult healthcare professionals for personalized advice and care.